Inquiry.
Inquiries, yes. Thank you, Speaker. Colleagues, I rise today to speak to Senator Seidman's inquiry, calling the attention of the Senate to weaknesses within Canada's long-term care system, which has been exposed by COVID-19 pandemic. As you recall, before our one-week break, I did speak just for a few minutes to this very important inquiry, and I want to continue. I want to thank Senator Seidman for initiating this inquiry, and I want to also sincerely thank all senators who have participated in this very important discussion. During the first wave of the pandemic, Canadians did not know what to expect. They were being given startling projections about possible scenarios, which included an alarming number of infections and deaths. Most of these did not materialize. But one number which uniformly troubled Canadians was when we learned in June that residents of long-term care facilities accounted for 81% of all COVID deaths. This horrific number has only improved marginally since then. On November 24th, the National Institute on Aging reported that long-term care and retirement homes in Canada now account for 75% of all COVID deaths. The grim reality is that if you are a resident of a long-term care home in Canada, you are 226 times more likely to die of COVID-19 than anyone else. This is an alarming number because it demonstrates the scale of the threat against our loved ones who are in their senior years. It has been painful to hear of many stories of parents and grandparents whose departure was hastened by the virus and in some cases left unchecked by those charged with their care. Our family faced our own scare just a few weeks ago when my 92-year-old mother, who is in long-term care in Manitoba, tested positive for COVID-19. No matter how much you prepare yourself, when that moment comes, your stomach goes into a knot. I want to take a few minutes to relive the days that led up to the call that we received, and I received. I am my mother's caregiver, or legal caregiver. My wife and my sister are her practical caregivers, but legally I am the one. And so I got the call from the care home telling me that the second floor of the care home that my mother is in, Rest Haven Nursing Home in Steinbach, they had tested the residents on the second floor. 11 of those residents had been tested positive. My mother, one of them. My mother is a remarkably strong woman, but she is in very frailing health. She is in a wheelchair. She has crippling arthritis. She cannot really walk well. She insists on trying. When they don't come and make her bed early enough in the morning for her liking, then she is found trying to get out of her wheelchair and make it herself because she's an impatient woman. I remember growing up when we had dinner at the house and we wanted to have a second serving. We had to hang on to our plate because when the last bit of it came out of the plate, my mother was cleaning up and washing the dishes, and she's still that way today. She's impatient. But nevertheless, she has crippling arthritis. She is, I used to call her a walking pharmacy, and now she's a rolling pharmacy. All the drugs that she takes to keep her going. So clearly, when we got the call, we naturally assumed this is the death toll, if you will. There would not be much chance. Our doctor called on The call we got from the home was on Friday. Our doctor called me on Saturday, and it happens to be my doctor as well as my mother's doctor. And he took time out Saturday at 8:30 in the evening. And he called and he explained to me the chances of my mother pulling through this. And he suggested that we needed to talk about end-of-life decisions. And so, of course, we started that. And he asked what questions I had and what my biggest concerns were. And I said my two biggest concerns were that we understand that that COVID is definitely a respiratory issue. And so my biggest concern was, will my mother choke to death? My second concern was, will she, as so many seniors have had to do, die alone? He assured me that with drugs today, my mother would probably slip into a coma, and with drugs they would be able to make sure she did not choke, that she would probably pass away very peacefully, but nevertheless would probably pass away within the next little bit. And he then called me actually a day later and said that, that he believed that we would be able to, one of the family members would probably be able to be with her at her side when she would pass away. But nevertheless, this was a conversation where really it was pretty much a done deal. My mother was going to pass away. I, of course, then had a conference call with my siblings, and we discussed how this would end. 11, as I said, 11 patients on that floor were tested positive. The youngest one being 80 years old, and the oldest being 98 or 99, I'm not sure of the age. And the manager of the personal care home called me daily. And I'm sharing the whole thing because this is very relevant to the rest of my speech. She called me daily, every morning, to give me an update on how my mother was feeling. And I should mention as well, we struggled with how are we going to tell Mom, because I had asked them not to until we had determined how we were going to tell my mother. And so we had made arrangements that one of the managers of the home would go into my mom's apartment, and they would tell my mother that she had tested positive, and then while they were in there, they would make a phone call to me so that I could talk to my mother. And so they did that. And when they got me on the phone, my mother was in the background, and I could hear her wailing and weeping and gnashing her teeth, and this was a horrible thing. My mother wanted to live. And it's not that my mother wasn't ready to die, but my mother wanted to live. And she has the feeling that I'm going to spend eternity in heaven, but eternity is a long time, so let me have a few more years here, because I don't need to go to heaven that quickly, because I will be there forever. They are adding to her personal care home 160 beds. It's brand new. And they have actually shown her on a plan which will be her room in that new care home. She will be able to move. And so she's looking forward. That's what she's looking forward to, that I will be able to be in a brand new room yet for however long I will have. So she didn't want to die. But I then talked to her, and I convinced her that, in fact, she didn't have any symptoms. She had been diagnosed positive, but she didn't have any symptoms. And so I really believed that, she might be able to fight through this. Well, I didn't believe that at all, but nevertheless, I managed to convince her. And so I settled her down, and indeed, she then went through the next number of days, myself getting the call from Lorraine Friesen, the manager of the facility, calling me regularly, telling me your mother's in fine shape, and she still isn't showing any symptoms. And of course, this went on for about 7 or 8 days straight. I talked to the doctor. I said, "Are you sure that she tested positive?" "Absolutely." Since then, 8 more residents tested positive, so a total of 19. Again, still the youngest being 80 and the oldest being right around 99. Out of those 19 residents, 4 have passed away. A 97-year-old just 2 doors down from my mother also made it through. They all had symptoms. My mother, I think, was the only one that didn't have symptoms. The 80-year-old passed away. The 80-year-old had had a couple of strokes. One 99-year-old passed away. The manager said this individual would have passed away if he would have gotten the flu. So these people had very serious issues aside from their age. But out of the 19 cases, there have been 4 deaths and 15 that didn't pass away, and I'm not sure if they have all gotten what they call the green light, but my mother has. My mother has gotten the green light, and we're tremendously thankful for that. And now, of course, she's afraid. She called me the other day and said they want to take me out of my room now again to give me a bath. And do you think it's safe for me to go into that disease-infected hallway and have a bath? And I said, "Mother, you've made it through this. You're going to make it through everything. You go ahead." And they have done that. So these were difficult times. You all know that I have been known to be not as cautious as many of you would even like me to be, and as many of you are. And I really told my wife, I said, when Mom when we got that call, I'm going to have to go back to Ottawa, hat in hand, and looking at my feet and saying, well, now we're one of the statistics. And then when Mother got the green light, I said to Betty, I said, now I'm going to have to be very careful that I don't go to Ottawa being a little too flippant and too arrogant and say this really isn't that big of an issue. If my mother can beat this, then surely we can all beat this. But we can't all beat this. Thousands and thousands of families have been in the same situation since March. It is incredibly difficult and incredibly challenging. Our family was blessed that my mother recovered without exhibiting any symptoms, not even a scratchy throat. As I said, her doctor recently gave her the all clear, and she is doing fine, and for this we are very thankful. But at the same time, I am deeply aware that many, many families did not have the joy of hearing their doctor deliver to them that same message. Many sons and daughters, spouses, grandchildren, received the most terrible news of all, that their loved one had passed away due to the impact of the virus. And in many cases, on their own, without a loved one there. These are lonely, lonely people. So, this has not been an easy time for anyone. But perhaps most of all for those who are residents of long-term care homes and their families. I know we were all moved when we listened to Senator Pate share her heart-wrenching story about her late mother. Such a lack of respect for the dignity of life is tragic, and the deficiencies which enable our most vulnerable to be treated in this manner need to be addressed. We have also heard stories of long-term care residents who caught COVID because they did not receive the proper care. because the proper safety measures were not in place, because someone was careless. We all know about the report of the Canadian Armed Forces on the condition of 5 long-term care homes in Ontario. The conditions were appalling, and the lack of proper treatment received by some seniors unacceptable. I am deeply supportive of every effort to address these inadequacies. But colleagues, today I want to spend some time drawing our attention to the fact that there is another side to this sad story. While there have been too many horror stories of care homes where the staff were irresponsible in how they handled this virus, there are other stories which must be told and other statistics which underscore our victories, our successes, and the phenomenal work of healthcare providers and the personal care workers have been providing to our seniors. My mother's home care is one of those, where the manager calls me on a regular basis, where my doctor takes the time on a Saturday night at 8:30 to call me and discuss the entire situation. The uncomfortable truth is that our elderly population who live in care homes are a high-risk population for this deadly virus. When it comes to this virus, the odds are against you if you are elderly. They move against you even more if you have an underlying condition which already compromises your health, and the odds are really stacked against you if you are also a resident of long-term care home. Dr. Nathan Stahl, a geriatrician at Toronto's Mount Sinai Hospital, put it this way in an interview with CTV News. You are taking the frailest adults, the frailest individuals who are in society. They live in congregate settings, and the settings they live in are often outdated and crowded, with many homes having 3 or 4 person rooms. And then you're introducing a highly transmittable virus that is highly lethal, a perfect storm for a disaster. But it doesn't end there. Statistics Canada recently reported there is now clear evidence that people with pre-existing chronic conditions or compromised immune systems are at a higher risk of dying of COVID-19, especially among those over the age of 80. These conditions include dementia, Alzheimer's, pneumonia, hypertensive diseases, heart disease, respiratory failure, renal failure, diabetes, chronic lower respiratory diseases, nervous system disorders, and cancer. And as Statistics Canada report noted, many of these conditions are significantly more prevalent among Canadians aged 65 or over, who accounted for 94% of all COVID-involved deaths in the first wave. Colleagues, it is imperative that we do everything in our power to protect our elderly and those who are residents in long-term care homes, because COVID-19 represents a very real danger to them. But I urge you to not take these statistics and generalize what is happening by casting a shadow over all long-term care homes and the caregivers who have worked themselves to exhaustion try to protect our elderly. Without question, there have been many failures in the system. We need to identify those and address them in order to safeguard the health and dignity of our senior citizens. However, we need to also realize that while the alarming COVID death count in long-term care homes illustrates the vulnerability of this cohort, the impact of COVID on long-term care homes has varied significantly. An article published in the Canadian Medical Association Journal of November 23rd noted this: people living in long-term care homes in Canada have been far more likely to die of COVID-19 than the rest of the population. However, the effect of COVID-19 on residents in long-term care has varied across provinces and territories. Colleagues, you wouldn't know it from the media coverage that there are many good news stories when it comes to COVID and the long-term care in Canada. Let me illustrate this by using my home province of Manitoba. Manitoba has been in the news lately because of its rising cases of COVID-19. We have been left with the impression that the situation in care homes across the province is uniformly disastrous. When our friend Senator Bovey spoke on this inquiry, she lumped Manitoba in with the terrible track record of Ontario and Quebec when she said, The situation is deepening in Manitoba, becoming darker every day. We are failing to provide our seniors in long-term care homes, and they are dying because of it. She noted that by November 17th, 36 care homes had experienced outbreaks. She said that Steinbach is another concerning center, and asked, did Manitoba have no option but to follow the sad steps of negligence seen in homes in Ontario and Quebec? Listening to this, colleagues, you might fear for your life to go to our province, especially southern Manitoba Health Region, which is where I am from. But let's take a step back and consider the facts. While 75% of all COVID-19 deaths in Canada have been residents in long-term care homes, the number in Manitoba is much lower at 44%. This number is still unacceptably high, but it is important to note that it is not only well below the Canadian average, it falls below the global average. The International Long-Term Care Policy Network reported in October that, and I quote, despite the difficulties arising from differences in definitions, in almost all countries where there have been deaths linked to COVID-19, a substantial portion of those deaths were among care home residents. Based on the data gathered for this report, the current average of the share of all COVID-19 deaths that were care home residents is 46%. Those are the numbers. The global average of COVID-19 deaths in long-term care homes is 46%. The Canadian average, 75%. The Manitoba average, lower than both, at 44%. Now, in the Manitoba Southern Health Region, which Steinbach is part of, the death rate is even lower. Deaths in long-term care homes due to COVID-19 are not 75% of the total. They are not 44% of the total. They are 17%, less than 1/4 of the national average. Colleagues, a single death is one too many. But we need to acknowledge that those who are working in our long-term care homes are playing defense, fighting a formidable enemy with the odds stacked heavily against them. And yet, despite this, many long-term care residences in southern Manitoba are mounting an incredible effort at crushing odds. As I said earlier, if you live in a long-term care residence, your chances of dying of COVID-19 is 226 times higher than anyone else. In southern Manitoba, however, the chance of a long-term care resident dying from COVID is only 30 times higher. That's still a lot, but it is 88% lower than the national average. Furthermore, after 8 months of a global pandemic in which 378,139 Canadians have been infected with the virus and 12,130 people have died, almost 3/4 of long-term care homes in southern Manitoba have still not had a single case of COVID-19 to date, and 85% have not had a single death. When you consider the incredible vulnerability of long-term care cohort to this virus, those figures are astounding. They tell us that most long-term care residents in southern Manitoba are winning the battle against COVID-19. Dr. Rosen, our public health officer, I think should ask southern Manitoba how to deal with this virus instead of telling them how to deal with this. I want to read a document here. It's personal care home outbreaks in Manitoba, just to illustrate some of the numbers. Out of 64 personal care homes in Manitoba, there have been a total of 1,108 cases. There have been 153 deaths. 49 of those 153 deaths were in one personal care home. 1/3 of them. So, outlook in Manitoba isn't as bad as what we have been told. Colleagues, I am in no way minimizing the very real impact that COVID is having in Manitoba and across our country. But I do want to put it in perspective for you so that you realize Manitoba, and especially southern Manitoba, is doing a much better job of protecting their long-term care residents than is sometimes being portrayed. In fact, at last count, 20 long-term care residents in Manitoba have had reported staph infections and yet continue to maintain 0 infections among the seniors who live in those residences. When you consider how easily and stealthily this virus moves, those numbers are evidence of a vigorous and vigilant effort to both detect the virus and prevent it from reaching our most vulnerable citizens. I think it is time to not only thank our healthcare providers and personal care workers, but to acknowledge that in many, many cases, their efforts have been beyond commendable. They have been heroic. But colleagues, there are some things that trouble me about how we are handling this pandemic. And these are some of the inconsistencies in our efforts and the tendency to allow policy to be dictated by emotion rather than science in our efforts to prevent the spread of COVID. Let me just speak to a few inconsistencies, again, because Steinbach has been on the map. Last weekend, a church just south of Steinbach wanted to have a service. And they had been on the news for having a service in their church building the week before. They decided that they would do it right this time. And they put up a large screen on their yard. And they decided they would have a drive-in service. And people would stay in their cars. The RCMP came along and allowed 5 cars onto the yard. This is a large yard. Allowed 5 cars onto the yard, then blocked, and there was about 100 cars that wanted to get on. They were all going to stay in their vehicles. They were going to watch the service on a large screen. They were blocked from going onto the yard to sit in their cars and watch a church service. I wasn't there, but I did happen to drive around the city of Winnipeg that day. And I drove by Costco, and I drove by Walmart, and I drove by a few other shopping centers, Home Depot. And I saw hundreds of cars on their yards. They were not limited into how many cars they had in the yard. They were limited in how many people could go into the store, but not limited into how many cars. They weren't even limited by how far apart the cars had to park. So that is okay. But going to a church service isn't. There are many in this chamber that know how I feel about some drug issues, marijuana being one of them. And yet the marijuana store, and I walk by it when I go for a walk. On a Sunday afternoon, the marijuana store is open. People can go and buy their recreational marijuana and their medicinal marijuana for sure. The liquor store is open, and I do frequent that. And on Saturday when I walked into the liquor store, there were 35, 40 people in the liquor store. That is allowed. Church services aren't. My wife went and bought me a pair of winter boots while I was doing Zoom calls. And she went to Sport Chek to buy me a pair of winter boots so that we can go on our walks. And that was fine. She could buy them and got them on the Black Friday discount. But while she was doing that, she decided to stop at Shoppers Drug Mart and buy a birthday card for one of her granddaughters. That was not allowed. She could not buy a birthday card. However, there were toys out for pets, dogs and cats, and she was allowed, if she had wanted to, we don't have a pet, but she was allowed to buy a toy for a pet. That somehow was an essential service. But to buy a toy for our grandchildren or even a birthday card for our grandchildren wasn't right. We have a school division that the public health officer has shut down, again, because it's southern Manitoba. So the Hanover School Division has been shut down. It's a large school division and takes in many towns, Steinbach the largest one. But the towns of Niverville, the town of Blumenort, the village of Landmark, they are all anywhere from 15 to 20 miles away from Steinbach, but they are part of the Hanover School Division, so they all had to be closed down. The Seine River School Division, under the control of the same public health officer, were open. The town of Le Brocry and the town of St. Anne border the city of Steinbach. They are in the Seine River School Division. They are 4 miles away. They could be open. But Landmark, that was 20 miles away, couldn't because Hanover had had a breakout. No consistency. We've talked about visitations to long-term care facilities, and we've shared that, and we all know the stories that we aren't allowed to go in and visit our parents. The one that my mother is in, they have a rule, and we certainly respect that rule. They have been trying to be very accommodating, but again, we have my wife and my sister. They are the two designated people to visit my mother, and so only they can go and visit her. But during this time of COVID outbreak, even they weren't allowed to visit her. So I'm wondering, why would we not allow somebody who is willing, and my wife was, to go there, certainly be tested, and this isn't a speech where I want to rail on the government, but if we had rapid testing, where people could get tested for COVID, and they put on the gowns that the home care workers have to put on, and they put on the masks, they do everything they have to, and then allow people to go in and visit their loved ones. Loneliness is the worst thing for these people. Loneliness is worse for them than death. Colleagues, when this pandemic started at the beginning of 2020, we heard from our provincial and federal leaders. And this is what they said: we are all in this together. We are all in this together. In the province of Manitoba, we have a snitch line. A snitch line. You see your neighbor doing something wrong, we have a real quick service. We can call a number and we can say, my neighbor is not wearing a mask when he or she is walking down the hall, or I know that they had one of their grandchildren visiting. Can you send the squad over? Because we also have a special squad that has been hired specifically to deal with COVID, to drive around the province, go and knock on somebody's door and see, are there more than 5 people in that household? And if they are, here's a $1,200 ticket. The RCMP don't even want to do this, so we formed a squad of some kind, and we now have a snitch line, so we can snitch on our neighbors, and enforcement officers will go hunting down the offenders. How, colleagues, is that being in this together? I fail to see that. There was a post on Facebook that captured the idiocy of this quite accurately, and here's what it said. A friendly reminder. So, the government is encouraging you to report your neighbors if they don't follow the new rules. Before following this advice, you should really consider the fact the government will not be there to help you jumpstart your car or lend you tools or a cup of sugar if you need it. They won't be an extra set of eyes to watch over your property if you are away. They won't keep an eye on your kids if they are playing in the street and someone strange is hanging around. We need each other. It's how we get by and live in peace. I could not agree more. Encouraging neighbors to turn on neighbors is not how we get through COVID. Instead, we will weather this storm by encouraging one another and standing by each other and pulling together. In closing, I want to acknowledge all of those who have lost a loved one due to COVID-19. You may have lost them directly because of COVID as the virus attacked their body, or you may have lost them because they were suffering from another illness and were unable to access the health care they needed due to the increased strain that the virus has placed on our healthcare system. Whatever the reason, our hearts and prayers go out to you. I also want to take a moment to once again thank all of our healthcare workers, long-term care staff members, who have put their own health at risk as they served in their places of employment. Your service is exemplary of the Canadian spirit which built this great country and never lets hardship or difficulty prevent us from taking care of those around. There is no question that these are challenging times, and the winter ahead could be a long one. But when things are at their darkest, even a little light is a lot of light. It's at times like these that a small act of kindness can make a big difference. A word of encouragement can lighten the load for someone. I pray that through the road we find ourselves traveling together, we will continue to bring out the best in all of us. And I pray that as we endure the winter ahead and move into spring, that we will all find fresh hope and new strength for tomorrow. Thank you.